Now, this video is all about hip release. There are muscles that are involved in hip rotation, and they're really important for stabilizing the joint. But there are muscles that are on the outside, and there are muscles that are on the inside. Now, when your joints are unstable, as they become in pregnancy, what can happen often is these smaller muscles on the inside tend to overwork, and that's because the larger muscles on the outside haven't got quite the strength that they should have. And a prime example of that is your big butt muscle, this big glute muscle here. That's supposed to be a really important hip stabilizer. But unless you've used your glutes a lot, particularly in walking and running actions, and sometimes when we walk and we run, we actually don't use good technique and we don't use these muscles. Same with other types of exercise. These glute muscles get a little bit lazy, so they don't function when they're meant to. What that then means is that those deeper muscles on the hip tend to really spasm and overwork. And in pregnancy, this is just all exacerbated because we get hormones going through our body, makes the hip joints a lot looser or less controllable, not necessarily looser, but just not as in control. So these other muscles start to really kick in. And that's where your deep core muscles come in, because when you pull up through them, it helps to stabilize you. But it's also where these big butt muscles come in. So one of the things I will be teaching you all the way through the Powerful Pregnancy series is to use your big butt muscle. We're going to be using that like crazy. However, what we also need to do is we need to release those poor little muscles on the inside that are screaming a lot of the time. Because when they scream, they often create a lot of pain. And that pain can occur right into the back here. But we can get rid of it just by moving. And one of the simplest ways to do that is with our lovely, lovely rocking the baby move. I love this movement. So our rocking the baby is where we just turn the leg in the hip. So think of the hip joint, and it's a ball and socket joint, and you're just internally rotating your hip in. And if you let your arms go, you can just move in this way. And I call it rocking the baby. So imagine you're holding a baby, you're rocking a baby, yeah? But this internal movement of the legs is really important when you're doing that. Now, if you get a lot of back pain, often it comes from either lying or sitting for too long. Now, I hear this so many times. Clients say to me, they feel fine during the day when they're moving around, and then they go to bed, go to sleep, get up in the morning, and they're in agony. Yeah? And it's often because you're told you can only lie in a certain position, so you're lying on your left side all the way through the night. Can't lie on your back, can't lie on your right side, and you wake up and you're feeling, chronic pain in your back. And often that's because you just need to move. So you can get up in the morning and you can do this movement, and it can help to start releasing, yeah, which is really important. You might find, however, that you've got big tightness that you want to stretch and ease out. So I'm going to go through a series of stretches. Now, I love this stretch because we can do it standing. In pregnancy, that's really practical because sometimes some positions are just with your bump, they're really difficult to get into. But it makes it really practical because you really can do this absolutely anywhere. You just need to have something really sturdy to hold on to. Now, I'm going to hold on to this chair. It's not particularly sturdy, but the thing is I'm not going to pull on it. I'm just using it as a balancing aid. So obviously you could do this without anything at all, but that makes it really hard. So we're going to use the chair just to help us balance, and I'm going to cross my left leg over the front of my right. Now this is important. I've got my left foot over my right leg, not my ankle, okay? So I'll show you from the front. See, I've got my foot here, not my ankle, and that's an important difference because that's going to enable me to get my leg into the right position. So foot onto the thigh, and then I'm going to push my knee out, and then I'm going to stick my bottom out behind and go into a squat position. And as I drop down into that squat, I can feel a lovely stretch going into my hip here. You may feel a stretch on your inner thigh, you may feel a bit of a stretch on your hamstrings, that's all good. If you're feeling it, it just means that they're tight and they're getting a bit of length as well. But what you're really aiming to feel is deep on the inside of your bottom, yep, a stretch deep into that hip joint. And you're pushing your knee out to the side as you do that. Think about your upper body posture because that's important. I'm going to do it wrong for a minute. I'm going to round my back. Now when I do that, I actually lose the stretch because basically now I'm stretching my back and not into my hip joint. So you've got to keep the shoulders down. You have to bring that chin in. The position of your head is important. So make sure you're balancing your head in the right position by bringing your chin in, and you're just pushing your knee out to the side. So this left knee on me is pushed out to the side, and I'm sticking my bottom out as I bend the supporting knee. So my right knee is bending as I do that. Okay, so that's a really lovely stretch to do. Now, if you've got one side that you know is tighter than the other, you might just want to stretch that one side out. Well, that's all good. You can do it absolutely anywhere, when you're at work, when you're out in the park, when you're at home. I love doing it with a kitchen sink. Put your hands on the kitchen sink and just do it at home. So loads of places you can do that stretch, a really practical stretch. You might be stuck at a desk all day and you can't get away from your desk, or you're just, I don't know, you've gone to the cinema and you're sat down in a chair and you can't get up. Yeah, so we can do some stretches sitting down. This is also really important if you have any issues with standing or with getting down onto the floor. It's really nice to sit on a chair sometimes and be able to stretch. So what you want to do first of all is move onto the edge of your chair. You don't want to be sat too far back onto the chair. So move onto the edge of your chair. And just think of the position I got into when I was doing the stretch standing. You want to get into exactly the same position. So I'm going to cross my left leg over, and I've got my foot onto my thigh, not my ankle, and I'm pushing the knee out to the side. And this already is a deep stretch. I don't need to do anything else really. Just that position is quite tough to get into actually, which is why I'm going to give you another alternative. And then you sit up tall. Yeah, because we don't want to round the back, we lose the stretch. But just by sitting up tall, you immediately feel that stretch deep into your hip. Again, chin position is important. If I wanted to take the stretch deeper, I could push that knee out to the side. And actually, if I come forward with my chest, it gets even deeper as well as a stretch. Now, you may find you can't actually get into that position for whatever reason. You might be really, really tight. Your bump might be in the way. So there are other stretches you can do as well. You can just bring your knee up outside of your bump. That's one way you can do it. Or you can cross your leg over the other and just turn and look over your chair. Now, that's going to give you a stretch through the waist as well. It's going to give you a bit of a stretch through your shoulder. But if you pull the leg across, then that's going to give you a nice stretch as well. If your bump isn't an issue, you can take the knee up higher, and you might need to adjust your bump to be able to do that, and you're just pulling this leg across. It's actually a different stretch to this one, but often what you find is when you feel tightness in this particular position, you find you've got tightness in this position as well. You're just stretching slightly different muscle fibers, but it's all good stretching to do. So just remember, even if you're sat down, you can do some stretching. Now, if you've got the luxury of being able to get down on the floor, we can do some stretches on the floor as well. And these are all for hip rotation, and they are all stretches that can help to release that back pain that often comes into the back. So I'm going to come down onto the floor. I'll work with my right leg this time. I'm going to take my right leg forward and then take the knee out to the side. So my right leg and my right knee is outside the line of my torso. So I've taken my knee out to the side. Now, this is a very common yoga position. It's called Pigeon Stretch, and you may have seen it before. It's a wonderful stretch for your hips. And I know so many women who love this position in pregnancy. There's all sorts of things you can do with this. You can move with it, and I love doing this. You can kind of roll from one side to the other. Yep, and you can keep your torso upright as you do this. If your bump is quite small, you can go down and you can bring it into a low position. That can give you a deeper stretch, but again, you can roll with it, you can move it, and just try to release your hips. Anything you do has to feel good. If your knee doesn't like it, you're not going to do it. If your pelvis and hips don't like it, you're not going to do it. And that's really important, because if you have any kind of conditions in pregnancy that can occur, there's something called SPD or pelvic girdle pain, that stretch probably isn't going to be right for you. But let me give you just one more alternative. So if you're really struggling, this is a very mild stretch, but it might be just the one for you. And I want you to try all of these stretches and find the right one for you. So this might be your stretch. So what we're going to do is we're going to cross the, which way am I going to go? I'm going to cross my right leg over my left leg. So this is going to stretch out my right hip. I'm going to take my arms over to the left. So recap, right leg is going to cross over left. Hands are going to go to the left. I'm then going to pull back over to my right. So that's right leg crossed, hands to the left, bottom dropping and pushing over to the right. And that will give you a milder stretch, but nonetheless a really good stretch for your hip muscles, for your deep hip rotators. So there you go. There's a whole host of different movements you can do there for the hips. that are going to help to release. So when you get that pain, remember you're rocking the baby. That's a really lovely way to start. You can use that for releasing hips. You can actually even use that in labor. It's such a wonderful move to use. And then you've got a series of stretches. Find one that works for you.